Children's Hospital of Scotland Way. That's our one entrance to enter the front door. We're now standing in the soon-to-be lobby of the new Children's Hospital. In front of me will be our new gift shop. That will be the first thing that someone would see when they came in the door. And over to our right will be our new chapel. And that will be another area that someone coming to visit the hospital would see. Around to our left would be more administrative and support offices, child light, things of that nature. And then we would come around to the right side, which is where a family would go to enter into the children's hospital. Behind me, if you were around McDonald room this is an area where parents can come and get a break, have a cup of coffee, take a shower, do their laundry, and maybe watch TV, just get a little rest in the child's room. It's meant to be an area for them to relax a bit. In about the area I'm standing here will be our concierge area. This will be an area where anyone who comes into the Children's Hospital would check in to assure that they indeed should be a visitor. And once that's confirmed, they would be identified in some way, maybe a wristband or some type of a badge, so that when they're inside the Children's Hospital, everyone will know they're supposed to be there. As you probably are aware, security is a key importance to us as we design and we care for our children. So this is a one checkpoint that you can get in, the public can get into the Children's Hospital.
We're standing in one of our medical surgical services rooms. There are 24 rooms on each floor, the 4th floor and the 5th floor. In our rooms, they're all private rooms. There's a family area, there's a patient area, and there's a staff area. Family area is towards the back with windows, beautiful views from the 4th and 5th floors. Then the patient area is obviously in the center with medical gases and everything that's needed for patient care. And the front area is for staff. We do have restrooms in each of the rooms. Towards the front of the room, they're a little bit small, but we've been very efficient in making sure that we get as much space into the patient rooms as possible. What you hear behind us is 130 workers working 10 hours a day, 4 days a week to build a beautiful children's hospital for the children of Central Texas. Down from the 5th floor to the 3rd floor, and it's about that fast. We're standing in the middle of the PICU. The PICU mock-up room, actually, and we've had several staff, physicians, leaders come over to look at the room. Very much staff-designed room with, again, a patient side in the middle, the head wall, gases, suction, air that's needed to take care of an intensive care patient. Staff side at the front of the room, and then a parent side at the back of the room.
Right over here to my right, back, is actually where the current cath lab is here at the hospital. We're going to maintain that cath lab at this point in time, but not outfit it, because in the future we are going to do pediatric caths here and eventually pediatric cardiac surgery, but that's probably 3 to 5 years down the road. So, as you can see, in the very, very early stages here, a lot of the demolition is done, not quite complete yet, and we hope for construction to start in about 2 to 3 weeks in this area to complete. Over here to my left is actually will be where our recovery area will be. Through past that wall, and then behind that is our day surgery area. So this will be our complete surgical area for the children.